Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin. The world of technology and healthcare, ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be asking the question, what things in healthcare need to be put on ice? And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 19 years of health IT content at healthcareittoday.com. It's going to be a fun topic today, putting stuff on ice. I think it was the CTO of the US that said it's much easier to put in regulations than it is to take them out, which is kind of what we're talking about today, because I think that's true throughout life.
Yes, I was going to say today's for those listeners. I mean, today is not talking about climate change. Although having gone through the polar vortex, we put a lot of stuff on ice. There's a lot of ice outside right now, but that is not what we're talking about. Although I'm pretty sure there are a lot of things in healthcare that we would love to put in a deep freeze.
Well, and we're kind of in our own deep freeze with this polar vortex, so that's fair.
That's right. That's right. Well, you went there already, John. So let's get right into it. Like, is there a regulation or sort of regulatory policy that you would love to see put on ice in healthcare?
It's tough because my guess is it's probably about half of them, or at least half of them I'd want changed. At least maybe all of them would be changed, and half of them put on ice. But two of them popped up in my head. The one that came up first for me was price transparency, and it's not because I don't want price transparency. I do, but the current regulation as it stands is just like it's just tiddlywinks, right? Like there's just no substance to it, and it's not creating any sort of impact. So to me, the idea that the government regulations pushing price transparency, it just doesn't make sense. And I think what's missing in the regulation with price transparency was an understanding of the complexity of pricing in healthcare. And it's never going to be Amazon where you go on it and that's your price. Even though my buddy at Moshe Health, he's working on that, right? But but that's kind of like cash pay services as opposed to the current complex system. We could, if we said, hey, we're getting rid of insurance and we're not doing insurance again, then we would have a very different market, and then we could have price transparency in a different way. But I don't think that's happening. So I think our current price transparency rule needs to be put on ice.
Oh, I like that one. I like that one. Hard to argue because you're right. It's got no teeth and it's not really achieving anything, right? We haven't heard anything about increased price transparency having an impact here. So
yeah, and
love
even
that
the
one.
penalties are meaningless. If they don't do it, it doesn't matter. And if they do it, it doesn't matter because no one's going to see it.
For me, I'm going to go outside the IT world and
Okay.
say I think the regulation that I would love to see put on ice is state-based restrictions on practicing medicine.
Oh,
Um,
yeah.
I
Good
I look
one.
at that and go, look, we have a doc shortage. Why are we putting up these arbitrary bordered restrictions within a same country uh, that you can't practice over a state line?
And
Um,
Colin just pissed off all the state medical associations that make money.
yeah, I mean, I get it. Maybe back in the day, there was a reason for it, but I think in our interconnected world, that reason is quite antiquated. Now, I'm not saying the estate base. I'm not saying do away with the state associations. I'm just saying you should allow people to practice, right, across borders, especially when we have the shortage. So that's one I would love to see put on ice, and it goes with Canada as well. We have the same restrictions.
You
So
do? That's
yeah,
interesting.
we have the same restrictions.
Here's the way you know that should be put on ice. Is there anyone that wants to go to a doctor because they're certified in California versus, Vermont? And the answer is no. No one gives a rip, right? And that's exactly the thing.
That's exact. That is exactly the point. Yeah, and that for me needs to go.
Wow, that's a good one. Well, here's one that will be slightly controversial, but I think EHR certification needs to be put on ice because
Hmm.
it's served its purpose. It's done, what it needed to. if everyone's certified up against it, then what are we doing? Like, and maybe the reality is this: 90% of EHR certification needs to be put on ice because they're already doing it. So let's stop wasting time certifying things that we already know they're doing. Uh, and there's probably ways to tweak it. Maybe if we certify elements of it or something to allow for innovation to come, because right now all the EHR certification right now is a barrier to anyone else doing anything of that nature. And so, to me, that's why it needs to be put on ice. We need to modify it. That's fine. If we want to open it up and, change it, that makes sense, so that any health IT solution could be involved in it. I'm open to innovations in that way, but EHR certification as it stands today is a barrier to anyone competing with the EHRs, and that's problematic in a lot of ways. And it's also not actually accomplishing anything. And I'm sure the kickback around this will probably be around, well, that is like one regulatory authority that ONC has, and they don't want to get rid of that regulatory authority. Now, if you're not using it for good, maybe we should. That's my argument. Now, like I said, could it be tweaked and opened up in a way that allows for innovation but still enforces some things? Maybe, but that one to me is just outdated.
I love it. I love how tech focused you are, John. That's a good one. And
And
yeah, you're right. I mean, it has served its purpose, right? Like when 90% of the technologies out there have the basics, which is what the regulations have in there, the basics of an EHR, is it really needed to be certified, right? Anymore. So, yeah. Although, yeah, I mean, I don't think anyone's making money off certifications anymore, anyways. Like it's just,
I
you
mean,
know,
it's the EHR vendors in some ways use that as a barrier for competition to come in and
sure.
compete with them. And here's a little projection. What if an ambient scribe company essentially becomes an EHR vendor, since they've already replaced all the clicks in the EHR? What are they doing? So it's like at that point, but would they want to do EHR certification? And is that useful? My answer is no.
Right. Right. Well, very cool. Very cool. I mean, I was just throwing one. I'm just going to double down on the whole doctor thing because there's a shortage worldwide. I say we need to do the same thing for foreign trained doctors. To my knowledge, there's
Oh,
not been a single study that says a foreign trained doctor is any worse than a locally trained one. But yet we've made it almost impossible for them to practice in a new country. And this is true around the world. Again, not just unique to the United States, certainly not unique to Canada, but we've erected all these barriers to this. And so we have perfectly good doctors driving for Uber, right? And to me, that doesn't make any sense at all when there's a worldwide shortage of physicians and clinicians. Why are we raising all these barriers when, for two people practice? I'm not saying they shouldn't be retested or something, but there's just way too much red tape and hassle to do that now. So
interesting.
want to see that
Yeah,
one
I
come
don't know
down.
enough about international, physician education to argue either way. But
Yeah.
it does seem if there's a shortage, we should find some more ways to address that. I
Mm.
think there's probably some telehealth things we need to put on ice as well. I mean, you're crossing state lines as an example of that, but the regulations are around reimbursement for telehealth and stuff. Some of that needs to be put on ice. We've proven, we have the data, telehealth's good, right? Like it's a powerful thing, and so I think we need to open up that one as well.
Well, on that related note, John, is there like a tradition or some sort of healthcare habit that you think we need to put on ice? I mean, we've talked about the regulations, but is there sort of something that we've just done all the time in healthcare that you think just needs to go?
So the one that really crops up all the time for me in healthcare is the fiefdoms. Like, it is amazing how specialties are a fiefdom, how practices are a fiefdom, how have their own fiefdoms. I mean, when you hear the stories of them hiding carts on wheels because they want to make sure they have one, right? They don't want to share it with the other one. Like, okay, I get where that's coming from, and there's ways to solve that problem. And so, let's address the problems. But people that don't want to collaborate with each other because of their fiefdom and they want to control their power and whatnot, that stuff just makes me angry.
You're lots of politics in healthcare, that's for sure. Related to that, well, my tradition that I would love to see go in healthcare is the not invented here syndrome. I get
Mm.
that healthcare is unique and that we do have unique needs compared to other industries and other things, but we do kind of arbitrarily disregard potential technologies and solutions. I would even say innovations that are related to workforce and innovations related to procedures from other industries just because it wasn't invented in ours. Um, so I think I would, and now it's getting better, but I would love to see that completely go away where we're just like, hey, we'll take what we take from another industry, adapt it to ours, and let's go.
Wow. See, I actually, when you said not invented here, I thought you meant more like it has to be our organization and our culture. We're not going to listen to the culture of other people, right? Yeah, you were talking about other industries, but I was even like within a hospital versus another hospital. This is how we do it here, right? Like that phrase is, I'm with you. Put that on ice. And the other one that comes to mind, I actually have two of them. One is the paternalism in the exam
Mm,
room, that they're like, I know better, I'm the doctor, like that stuff is just gotta go. Now I think the other's true too. Patients that aren't respectful of doctors, that needs to be put on ice as well. So like that's not fair either, like, but it needs to be a collaborative process and a respected process on both sides of it. That the doctor knows certain things and the patient knows certain things, and we need to have respect both ways, and that's going to become more and more important as patients know more things, and as science progresses, it's progressing so quickly, doctors can't keep up with everything. So let's not assume that the doctor knows everything. Let's collaborate together and use the skills and expertise that each has. So that paternalism is a problem for me. And then I'll throw this other one in quick, which is the waiting rooms. Like, can we just get rid of them? Like, come on. I mean, sometimes you have to sit there, but there's so many elements. One is like get rid of the clipboard, right? Like I shouldn't be doing clipboards, so you shouldn't need a waiting room. And then the second is that if you have me waiting so long, you need these massive waiting rooms. That's a problem too. Like let's figure out your schedule so that there's not as long wait times. So yeah, put those waiting rooms on ice.
I love that one. As a Canadian, I don't like waiting rooms. There's symbolic of the long wait time. So I agree with you. Let's get rid of them. Let's put those on ice. Um, I'm going to be very un-Canadian, John. I'm going to say something controversial.
Oh, really?
There is a tradition that I would love to see put on ice, and that is aggressive bill collecting by healthcare organizations. And I mean in the extreme sense. Like to me, um, putting people into financial ruin because of an unpaid medical bill to me goes against do no harm. Like it is
Mm.
fundamentally, why would you do that? Like it is complete to me, it's completely wrong. I'm not saying they don't deserve the money. I'm not saying they shouldn't find a way to get the money. And I know I don't have an answer here, but the answer we have now where you farm out the debt to these aggressive collection companies who are essentially bankrupting these people, like to me that is wrong. Like it's just fundamentally wrong. I don't have a solution, so don't I'm just going to sound off here, but that is something I would love to see put on ice.
Yeah, the real solution is lowering the cost of healthcare so there aren't bankrupting as many people, but that's a much harder problem.
It is indeed. That is indeed. Hey, if you're just tuning in, you are listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're asking the question, what things in healthcare need to be put on ice? And hey, if you're going to be at HIMSS 25 in Las Vegas, you have an important announcement that you want to make, or you want to capture a client success story, well, then our 3-in-1 interview package is a perfect fit for that. We do the interview at our on-site studio at HIMSS 25, and then we turn it into a video, an article, and a podcast. And then all three get promoted to our audience. If you're ready to make a splash at HIMSS 25, go to healthcareittoday.com/splash to learn more. So, John, is there a technology that you want to put on ice?
Yeah, there's quite a few. It's interesting though, right? Because when you look at technology and you're like, someone's paying for it, so they must value it to some degree, right? Like, so this one is a little bit harder to look at because you're like, they wouldn't be paying for it if they didn't need it to serve some purpose. But here's the one that I think, hits me the hardest. And that is, and it's a mix of the pager and the seven other comm systems that every hospital health system has, right? Like, why are we paying for so many different communication systems? Like, let's consolidate down. I get that maybe you need two or three, depending on how large you are, and some different needs, some emergency one versus texting one versus, in the EHR or something. But like, man, it's amazing the communication system proliferation that happens, and it just gets worse as they acquire ones, and there's no cross compatibility at all. And so, yeah, I mean, if you're still paging, that's redonkulous. Like, come on. And and then let's get past all the variety of communication systems where people don't even know where to go because there's so many systems.
I'm with you there. I'm with you there. And this is coming from somebody who used to work in that space, right? So too many communication protocols and systems. Well, related to that, actually, is one of my things. One of the techs that I would love to see put on ice is something called nagware, right?
Mm.
And it's sort of a broad term for all these systems that do nothing but remind you of something, right? Like there are enough alarms and enough things that happen in a hospital. We don't need more for the nurse. We also don't need more as patients. I don't need 14 different systems telling me, hey, I should book this appointment, or hey, I need to do this or that. Or it's become noise now and it's lost its effectiveness, much like car alarms have lost their effectiveness. We're just so immune to them now. It's like I don't even look at all the alerts I get. Like, oh, is my Fitbit telling me I should be like getting up out of my seat, or is my doctor telling me I should book a 9 month check in, or my dentist, or my chiropractor? Like, it's just it. Nagware has just proliferated, so people have now started to tune them out. So I say put all that Nagware stuff on ice. We need to find a better way.
It's interesting because we've all been there, whether it's a email newsletter that we're on, or whether it's an update on our phone that we get all these notifications about, and we're like, there's some, and I don't know what the threshold is, right? And we probably all have different thresholds depending on what the notification's coming from, but we reach a certain threshold, we're like, it's just noise. I'm just going to swipe it off and then eventually uninstall. Now, the challenge in healthcare is that puts lives at risk if you do that with the wrong message. And so that becomes more challenging to do it. So, but that's why I think we need to consolidate it down to just the important messages that are going to make an impact. So that's a good one. The one for me that I'll put out there is data centers. Like,
Mm.
I mean, I get why you may need some. You're going to probably have to have one for your organization for certain things that need to be on site. But for the most part, I think the local data center is done. You can outsource it in a much better way. The bandwidth is there, the redundancy of the bandwidth and the speed of the bandwidth. That's all there to be able to do cloud in a really effective way. Sure, there's a few edge rural cases where I might disagree with myself, but other than that, healthcare organizations should not be in the data center business. They should be in the impacting care business. And there's enough people who are really good at data centers. Let's use them.
Let's make data centers go the way of telephony closets, right? Remember the old days? Remember those, right? They used to have all the telephony equipment in a giant room because you needed that giant switch and all those things. And now we just do everything with software,
It's
right?
funny you say that though. Like, should desk phones be put on ice too? Like, I see it on people's emails, and I'm like, why would I ever call their desk phone? And what I wonder what they use it for. Do they still use it? Right? Like, I don't know. It's been so foreign to me because I haven't had one for more than a decade that it's like I'm like, oh wait, that's right. I guess you could still call that.
I'm with you on that. Well, for me, the tech, yeah, there's one more. I mean, obviously, I'm going to say fax machine, not the fax protocol, just to
Mm.
caveat that. But the fax machine needs to be relegated to the ice pile. In fact, you can put them in the data center, storage area that you're going to have now. Just put them all in there. But yeah,
You can burn them in infamy.
there you go. Like we just don't need fax machines anymore, especially on the printout side. If why receive it in a fax machine? Put it in electronically, have it go right into the EHR. The eFax protocols have been around for a long time, very tried, true, works. Just do that. Like don't why are we printing stuff? And why are we using a fax machine to be the interface? To get a scanner.
Yeah, I debated printers, but there's a few times where you do need it. So I couldn't quite put printers on there, but printing massive jobs, that one I can. But yeah, the other one that came up is a little bit like yours as far as desktop computers. Like we should be doing thin clients in most cases, laptops, tablets. I get it, desktop computers can serve their purpose and whatnot, but that thin clients are just so much more powerful. They're so much more secure. They're easier to swap out. So I think the desktop needs to go. At any sort of reasonably sized enterprise, the thin clients more than enough.
Kind of funny, right, John? You're talking about a terminal. Right? This is back to the mainframe days. You're talking about a dumb terminal at the other. I know it's a thin client, but it's just it's a view screen and a keyboard. That's all you need, right?
Well, the terminal was nice. It just worked. You know what I mean? So,
True.
but and these aren't really terminals. They're smart. They're they're
Yes.
they're,
Yeah.
they're much more powerful than. But there is something about that terminal that was just plug and it worked, right? Like that. Yeah, I miss those days to some degree.
There you go. I'll throw in this last term of tech. I mean, blockchain, anything in healthcare. I mean, can we finally put that on ice? Like, maybe it'll come back in 10 years' time and 5 years' time. We'll figure out some use case for it. But right now, I just think that tech needs to be put on ice in healthcare.
Yeah, if you have quantum computing, maybe it makes sense. I don't know, but
There you go.
yeah, when someone tries to pitch me blockchain now, my eyes just roll. It's crazy.
Well, and to that end, our final question, John, what buzzword in healthcare would you love to see put on ice?
So this one might piss you off a little bit, but I think patient engagement, like it's just been used so many ways, and they really have, they kind of say it but don't live it, and that just makes me angry. And so like I almost think you can't claim that you engage patients, and that patient engagement matters to you. Like you show me and then I'll believe it. But so that one really bothers me. And one that's kind of related is value-based care. Like I don't know. I'm getting kind of jaded and old. I don't know. I'm a curmudgeon, but value-based care and how we get to value-based care, I'm just not sure like that that's even possible. So I'm kind of like, hey, I get the idea. And if we had perfect information, we could do value-based care in a really powerful way, but we don't. And there's too many people profiting off, the current dysfunction and fee for service. So I don't know. I'm not sure. I just don't see the path to value-based care. I guess that's why I'm kind of tired of it.
Yeah, those are, we'd love to see it, right? Like both of
Yeah.
those, we'd love to see it. But everyone says it, and have we really made any progress to it?
Yeah. Show me
I've
how you really engage patients. Show me how you really care about the value that the patient has. Yeah.
So the buzzword would love to see put on ice is digital twin.
Mm,
Um, I have seen that used in completely different contexts and so many different contexts that I
I was
think
gonna
it
say
has lost
so
its
many.
definition. Like, what is a digital twin? Like, is it literally your digital twin, like an AI avatar? Is it a digital twin as in it's all your medical information, and it's made digital? Is it an actual 3D rendering of the inside of you based on CT scans and stuff so that people can navigate and figure out how to do the surgery ideally? Like, just describe that, because when you say digital twin, I don't think everyone knows what you're talking about. Like, it's just so amorphous of a term.
Yeah, you're right. If someone says digital twin, I have to ask them, what do you mean?
Right.
So you're 100% right on that. Here's one that I think actually may already be on ice. And I saw it recently and I was like, oh, that's true. And I think the way they phrased it was, what happened to big data? And I was like, oh, big data
Mhm.
has kind of been put on ice. Now, you could argue that LLMs are big data essentially, but creating meaningful results and meaningful, outcomes out of it. But yeah, you're not hearing the big data. You're hearing data's gold, data's valuable, stuff like that. But I think big data might be already frozen.
Like, you're right, right, right. I've not heard that term in a long time. In a
Yeah.
long time. Yeah. I've heard data warehouse more often than I've heard big data.
Yeah. My favorite is that big data was such a hype a while ago. Someone came to me and they said, we want to work on skinny data. They're like, let's just take a slice of data and do something meaningful with it rather than aggregate all the big data and do nothing with it. And it was like, wow, that's how far big data had gone. But yeah, we don't hear about it anymore. We hear about using data, leveraging data and analytics and different things, but I think big data is dead.
Well, there's a buzzword that I wish we'd put on ice, and that's cyber attacks. But unfortunately, that is not going to happen. But that's more of my
Yeah.
wish list to say, I wish we didn't have to talk about this.
You wish we
Uh,
could put it on ice.
I wish I could put it on ice, but yeah, that's I think it's going to be a hot topic, unfortunately, in 2025 again. But yeah, that's I don't have any other ones. But I got to go back to what you said before. I don't disagree about your patient centeredness and the patient engagement stuff because I
Mhm.
think you're right. People have used that and they just say it now. It's lost its impact and it's lost its meaning. Um, and yeah, you see it all over everyone's marketing, right? And I think it needs to be retired.
Does AI need to be retired? I don't know.
Yeah, I think we're getting pretty close on that one. I mean,
That one's an
it's
interesting one because we're going to
yeah,
talk about it, whether we like it or not, whether it's on ice or not. Question is, do we need to pour a cold drink over it and so we can enjoy it? I don't know, but it's everywhere and like you said, lacking meaning in a lot of ways.
yeah. I wonder. It's funny because I wonder if one day we'll look back and go, "Hey, remember when we used to talk about AI as if it was a separate thing? It'd be
Mhm.
like, do we look at will we look at AI the way we look at, hey, I use a spreadsheet? Like,
Mhm.
of course you use it. Like, why would you? Like, it's just become part of how you work. Not it's not something special anymore.
Yeah, it probably evolves to bots and agents and assistants and whatever, and we don't think it's AI, it's just all of those things combined. Yeah, that's interesting.
There you go. Well, we'll see. But hey, thanks to all of you who tuned into this episode of Healthcare IT Today. And remember, if you want to make a splash at HIMSS 25, go to healthcareittoday.com/splash. And to find out more details about our show, go check out the programs page on healthcarenowradio.com. And please share your voice and engage with the community by using the hashtag on social media, HITSM. I'm Colin Hung with my friend and health IT collaborator, John Lynn. Thanks for listening and have a great week.